Mr. President.
The senator from Alaska.
Mr. President, request that proceedings under the quorum call be suspended.
Without objection.
Thank you, Mr. President. I understand that we're in a period of morning business. Is that correct?
The senator is correct.
Thank you, Mr. President. I'd like to speak this afternoon for a few minutes about the health care debate that has gone on here in this Congress, in this Senate, certainly, throughout this past year. President Obama promised that the Democrats' health care bill would reduce the spiraling cost of health care, and the promise was made that if you liked your health care plan, you could keep it. But with released government reports confirming, not necessarily confirming every day, but it seems like just about every other day there is yet another report that is released that confirms what many of us who opposed a federal takeover of the health care system feared all along, that higher costs, less access, and unsustainable spending. And the President and this Democrat-controlled Congress need to repeal this bill, put in place meaningful health care reform measures that will allow individuals to exercise more control over their health benefits and see our premiums actually go down instead of up. I want to speak to some of the reports that have been coming out. We'll start with the government report that came out 4 weeks after the health care bill was signed into law. It was the President's own chief actuary at the Centers for Medicare and Medicaid Services, CMS, a gentleman by the name of Rick Foster. And he released his report saying that President Obama's new health care reform law will actually increase national health care spending by $311 billion over the next 10 years. Foster's report also said that about 14 million people would lose their employer coverage by the year 2019, largely as a result of small employers that terminate coverage and workers who currently have employee coverage enrolling then in Medicaid. Mr. Foster also reports that the $530 billion in Medicare cuts may not be what he calls realistically sustainable, potentially driving 15% of all hospitals, nursing homes, and similar providers into the red within 10 years. This would cause providers that depend on Medicare for a substantial part of their business to be forced to drop out of the program and possibly jeopardizing access to care. And those are Mr. Foster's words, jeopardizing access to care for our senior citizens. Now, the situation in my home state of Alaska is particularly dire, and I've stood on this floor and I've discussed and certainly spoke to the statistics. Back in March of '09, the Institute for Social and Economic Research at the University of Alaska reported that just 13 out of 75 primary care physicians in Anchorage were accepting new Medicare patients. Now, Anchorage is our state's largest community, and we had 13 out of 75 primary care physicians who were accepting new Medicare patients. Now, just 15 months after this report was done by ICER, that number has now dropped to the single digits. Further cuts to Medicare will only worsen the situation for the most vulnerable Alaskans. They were our seniors and our disabled. And this was one of the main reasons why I simply could not support the health care bill that came forward. The issue as it relates to access of those who are Medicare eligible has been a crisis in our state that only continues to worsen. But there are some other reasons for my objections. In May, so last month, the neutral government scorekeeper, the Congressional Budget Office, or CBO, revised its initial cost estimate of the bill to say that the law will likely cost $115 billion more in discretionary spending over 10 years than the original projection. So 2 months after the law is enacted, the American people learn from yet another new government report that their Congress has passed a bill that would increase their health care costs and reduce their benefits. And again, this was something that Republicans warned about over and over again during the last year as we discussed health care. Now, Mr. President, the small businesses in this country stand to lose the most under this health care bill. They were promised a pipe dream filled with tax credits to save small businesses money, but the bill is simply not having that effect. In fact, it's the opposite effect. The Associated Press released a fact-check article last month that stated point blank, the small business tax credit included in the health care reform falls short. And the story interviews a gentleman by the name of Zach Hoffman, and I know that this story has been repeated here on the Senate floor, but it's worth repeating. Mr. Hoffman is the owner of an Illinois furniture company. He's got 24 employees. They earn an average of $35,000 a year, clearly a very modest wage by any standards. Yet the amount of the credit that Mr. Hoffman calculated he would receive under this new law as a small business would be zero to him. And the AP article points out the fine print that many small businesses won't qualify for the credit was left out of the administration's press releases that touted the credit's broad eligibility. But you really just need to go back to the individuals that are being impacted by this or had hoped that they would be impacted positively. Go back to the Illinois small business owner and look at his comment. And he says, it leaves you with this feeling of bait and switch. But thinking of how Mr. Hoffman could be eligible for the tax credit, he learned that all he needed to do was to cut his workforce to 10 employees and cut their wages. And to this, the small business owner says, you know, this doesn't make sense. He says, that seems like a strange outcome given that we've got 10% unemployment. Well, I think we would all agree it's a strange outcome. It's an unacceptable outcome is what it is. Mr. President, this Illinois employer situation is no different than any other employer regardless of what state they're in. In states like Alaska and other particularly high-cost localities, whether it's New York City, San Francisco, where wages are higher because of the cost of living, the employees stand to lose because they won't be eligible for these tax credits simply because they pay their employees higher wages than are allowed in the health care bill. Now, since enactment of the health care law, we've also heard from well-respected health care consulting firms that have released information showing that businesses fear the law's new employer mandate penalties. Now, according to the report, more than 1 in 4 employers, about 26%, and nearly 2 in 5 retailers may not be in compliance with provisions requiring coverage of all employees working over the 30 hours per week. And of those, a majority, 54%, said that they would consider changing their business practices so that fewer employees work 30 hours or more per week. This would be a devastating blow to an already ravaged economy. Now, we've got another well-known consulting firm, Mercer. They released a survey of the impact on the new health care law on employers just last month, and the survey shows that there is near unanimous belief by employers that the new law will raise employees' premiums. Only 3% of employers that responded said that they believed that the legislative changes would not cause their premiums to rise. This doesn't demonstrate very much faith in how this is going to benefit them. 1/4 of respondents believe that the bill would raise premiums by at least 3% over and above this year's normal rise in costs due to medical inflation. Now, last week, there was a PricewaterhouseCoopers report that stated that the cost for businesses providing health coverage to employees will jump by 9% next year in 2011, which analysts predict employers will shift more of the costs to the workers next year. And for the first time, most of the American workforce is expected to have health insurance deductibles of $400 or more. Now, also, last week, the administration's new regulations on grandfathered health plans were released, outlining the various ways in which existing employer health plans will be forced to change under the new law. And according to the Obama administration report, these regulations could result in nearly 7 out of 10 workers and 80% of the workers in small businesses. So 80% of the workers in our small businesses would see changes in their plans. So in other words, under the new health care bill, more than half of those who get insurance through their jobs may be forced to change their plans, whether they want to or not. Internal administration documents reveal that up to 51% of employers may have to relinquish their current health care coverage because of the health care bill, which takes me back again to the statement that the President initially made. If you like your health care plan, you can keep it. Well, Mr. President, that's simply not what we are seeing. It is not translating in the real world. And then, of course, we have the CBO letter that just came out. This was dated the 21st, so just the day before yesterday. And this comes from Mr. Elmendorf, the director of the Congressional Budget Office, in responding to the ranking member on the HELP committee about the high-risk pools. And that letter confirms that an additional $5 to $10 billion would be needed to fully fund all eligible enrollees in the high-risk pool expansion. And further, that the new high-risk pool program, which was supposed to be providing health insurance coverage to Americans, but to date, the government has failed to provide any funding for these new high-risk programs, and those with pre-existing coverage have not been able to enroll in these new high-risk pools. But again, coming from the Congressional Budget Office, these new estimates that, in fact, the funding available for the subsidies is simply not sufficient to cover the costs of all applicants, and then the additional cost that is anticipated, an additional $5 to $10 billion to cover all eligible enrollees. Now, with new government reports telling us that this bill won't reduce the premiums, and with employer groups looking at how they can minimize the hits that they're taking under this new law, we've put American businesses, particularly our small businesses, in peril of dropping employees to avoid the $2,000 per employee penalty called the employer mandate. And we've put these small businesses in peril of reducing employee wages in order to qualify for small business credits. We've passed a bill, Mr. President, that hurts our small businesses during one of the worst economic downturns in the history of our nation. Investors Business Daily on Monday, last week, stated that small firms will be even likelier to lose existing plans. In fact, and this is their statement, the mid-range estimate is that 66% of small employer plans and 45% of large employer plans will relinquish their grandfathered status by the end of 2013. So in the worst case scenario, 69% of employers, and again, 80% of smaller firms, would lose that status, exposing them to far more provisions under the new health law. So again, it makes you ask the question, was this what the President envisioned in health care reform when he said, if you like what you have, you can keep it? I think that this new law has clearly failed to keep the President's promise to the people. And it was for these reasons that I objected at the time that this bill was moving through the process. I have stood out and strongly supported the state of Alaska and other states' efforts to strike the most egregious provisions of the law through a multi-state lawsuit. And again, why I voted to repeal the entire law when we had that opportunity this past March. This law is not what the American people wanted it, and it's not what our President promised. I believe that the legislation has to be repealed. It's got to be replaced with sensible alternatives that are widely supported. We know what so many of those are: buying across state lines, implementing medical malpractice reform, reimbursing for quality of service and not quantity of services. This is what the people wanted. This is what the American people expected. Yet this is not what was delivered. It's time to help our economy rather than to kill it with this legislation that was passed. Mr. President, I yield the floor, and I note the absence of a quorum.
Clerk will call the roll.
Mr. Akaka.